Good afternoon, Mike Jones, here again at the beginning of a work week with you, talking again about what the city of Fredericksburg is doing to work within the parameters of the COVID-19 crisis and how we're trying to help you be better informed. Let's talk about the statistics today. We'll deal with the local health district. We're now up to 585 positive cases. Again, as the amount of testing ramps up in the Commonwealth of Virginia, we're going to see more positive cases, and we have seen that on a consistent basis since the end of last week as the testing ramped up. 288 cases in Stafford, 195 in Spotsylvania, 35 in King George, and 32 in Caroline. We do have a total of 45 cases, 6 new ones overnight that we are doing contact tracing on here for the city of Fredericksburg. Total of 23 new cases since yesterday, and that's down a little bit. The end of last week, we were well up in the 30s, so that's a good sign. The other thing that we are staying steady with, thank goodness, is the fact that we only have 11 deaths in the health district. So that's a positive sign. The other positive signs that we can take from this is the number of hospitalizations with people that have COVID-19 are down, the number of people that are being released from the hospital is up, and the number of people in ICU beds and using ventilators to breathe throughout the Commonwealth is down related to COVID-19, so that's all positive news. We are also down a little bit in the number of people in the actual hospital that have positive COVID tests, so that's a good sign as testing starts to ramp up and as maybe we head toward even more positive tests as we move forward. Commonwealth of Virginia, we've now tested over 122,000 people. And we have, by the end of the day, we'll probably have 20,000 people that test positive in the Commonwealth. Unfortunately, 684 Virginians have perished due to the effects of COVID-19. We'll put the rest of the statistics up on our written page. Let's talk a little bit about face masks or face coverings, as we like to say. For people that are using that, there's probably a lot of controversy out there, but we do recommend that you use face coverings, especially if you're going to go out and about, if you're going to go to the store or going someplace else. It's more for other people's protection than necessarily for you. The idea of a face covering is in case you're asymptomatic, you're not going to potentially give the virus to somebody else, and if they're wearing face coverings, they're not going to potentially give it to you. So face coverings can be as simple as a regular cloth mask. Just make sure that after you've used it, that you do wash it a couple of times, just regular soap and water. Washing it and cleaning it is good so that you can reuse it and go from there. There are a lot of different places that have face masks available, and a lot of people are making them available, and people are using that. If you don't have a face mask, a bandana or a scarf or other type of face covering that covers both the mouth and the nose area, still allowing you to breathe, but covering that up and preventing anything from droplets coming out would be appreciated. And again, we can't emphasize enough personal hygiene with good hand washing, covering your cough, and not touching your face, eyes, nose, anything like that. So that's a positive aspect of that as well. So we want to recognize those things. And again, today is May 4th. In case you didn't know, well, pass it on. Since I'm with the fire department, it's International Firefighters Day. So if you see a firefighter or an EMS worker out there, please give them a thank you for what they do. And don't forget our friends in law enforcement. They work very hard at what they do as well, and they deserve a pat on the back. We'll provide additional information as we comes available. The governor is supposed to speak at 2 p.m. today, and he's going to talk about a phased reopening of Virginia. So hopefully we'll have more information about that later this week. We'll talk to you soon. Thank you.